everyone, and welcome to Arthritis at Home. Today, I'm joined by an award winner from the Arthritis Society Strategic Operating Grant, Dr. Heinrike Schmeling, who is a professor at the University of Calgary, as well as a pediatric rheumatologist who is currently practicing at Alberta Children's Hospital. So thank you so much for your time, and thank you for joining us today.
Thank you very much for the kind introduction.
So I have a few questions I'm going to get into, but Dr. Heinrike Schmeling, do you mind telling us about how you're involved in rheumatology?
Yeah, so first I would like to say that I grew up in Germany and did most of my medical training in Germany. And I started up as a physiotherapist, and then I moved to medical school. I did my pediatric residence training. And during my pediatric residence training, very early on, I met my major mentor and teacher, Gerd Horneff, who is an international known pediatric rheumatologist, who got me engaged in rheumatology. So I started very early on to be involved in the care of pediatric rheumatology patients as well as in research. And then I wanted to learn more about pediatric rheumatology, and there's an exciting and very nice, well-known program at the Kids in Toronto, and I did my fellowship in pediatric rheumatology at the Kids. After that, I was lucky and I got a position here in Calgary, and I was appointed in 2009 already as a pediatric rheumatologist at the University of Calgary, and I started here my career at the Children's Hospital. And my major focus, and what was always inspiring me, was really to my patients. My patients make my questions to research, and I was very focused and always eager to improve care by integrating research and to develop new care models, to do clinical trials, and and to at the end to have a full improving care model that serve our patient best.
That's so well said, and I think there's something so important with especially the age group that you work with. So more recently, this award was for the project titled A Pilot Randomized Control Trial, Feasibility and Acceptability of a Virtual Adolescent Self-Management Program for Juvenile Idiopathic Arthritis. So can you explain to us what is a pilot study and what purpose does it serve in terms of helping researchers develop these evidence-based interventions?
That's a very good question. So a pilot study is kind of a third step to an entire research protocol. So it's often smaller size study, assisting at the end to planning and modification of the main study. So it's helped to improve the process, design, and at the end also to get to prepare ourselves to do then a full-scale study, what is very costly. So at the end, the goal is to have a good setup, to save costs, and to do really what leads to a very clear outcome. So the analysis of the study helps also in sample size, or how many participants needs to be recruited in the groups, and to finalize little things to have at the end a very good, clear outcome.
Yeah, absolutely. I think you bring up a really great point. So a pilot study in health research is like, as you said, a first step. And we do it instead of going straight to the big randomized control trial, because as you had said, right, it's very costly. And if we don't do it properly, not because we didn't do the proper planning or we didn't have the right team, it's just because there's so many parts to it. You never know with different contexts, right? We saw what happened to COVID, right? Everything went virtual, and now virtual is the new thing, right? It all depends on context. So we do these kind of smaller studies so that we can test as you in the title of your project, the feasibility and the acceptability of this virtual model that you've designed for self-management. Very exciting. My next question is, can you tell us a little bit about the self-management program that your team has co-developed? How will it be delivered? Like, oh, I know it's virtual, but how does it work?
Yeah. So first, I would like to give a little bit of background. So this whole transition, most of the people think transition is only you're turning 18, then you're transferred to adult care, and this is kind of the transition period. But the fact is that transition starts very early on, even in the age of 8, 9, 10, or even earlier, that we try, or we should do, educate patients to take more and more steps to self-management, to know about the disease and to look for themselves. And often we are not doing a very good job because clinics are very busy, and often you talk more with parents than with the patient, and it's very hard to integrate the kids and that they take ownership of their own. And the fact is also, in recent studies has shown that only like that 25 to 75% of young people get lost in follow-up when they're transferred to adulthood. And to close this gap, we want to do better in this kind of, to train our young to have a successful transition. And it's also a very nice story. So a former patient reached out to me when she graduated from school and asked me if she can do some research with me. She started first to develop some projects on barriers of school, and then she wanted to do a master's. And during her master's, she by herself defined, I was lost as an adult, and I want to develop the program for self-management for kids suffering from arthritis. So during her master's studies, she developed this proposed self-management program and did some focus group with patients, with young adults, if they like this. The program consists of 4 sessions that she developed with the help of alien health professionals, with other patients, with physicians. And their one session is the overview or diagnosis of JIA. The next one is daily living and exercise. Third session is coping strategies, how I cope with pain, how I cope with my disease by itself. And the last one is really management of the disease and treatment. And she provided this focus group with youngs, and this was very well accepted. And I think I want to share that some people even said that what they liked in this program is that it's not focused on my parents, it's about me. I can decide, I learn. And it was very exciting. So she finished up a master studies, and the next step is now really to prove the program in a randomized controlled fashion to see if the concept is valuable and feasible and acceptable. So the study, this proposal, what we put into the Arthritis Society is focused on a virtual program. It means, yeah, it's virtual. It's not in person, it's virtual. And we included 5 centers across Canada to get different experience from each center. It's Vancouver, Winnipeg, Edmonton, Toronto, and Calgary. And we will do randomized in each center 2 groups to the intervention who received the program and 2 groups as a control group. The control group, so they're receiving only normal care without the intervention of the program. However, they will have the opportunity when the study is finished to also to get the program after. And in this program, will be delivered virtual through Zoom or any kind of other interventional, and it will be provided by health professional, a physiotherapist, a pharmacist, a nurse, and a psychologist who will be trained to deliver the session. And one of the major aspect of the study is also, like, one thing is really to see is it's acceptable and everything, that what we know. But the new aspect is it will be virtual. And we know all how virtual works, but we don't know really how good we are in delivering virtual sessions, to get patient engaged, have interaction, how the technology works, how is even the setup of the pictures that the people out there, how they can communicate, that everybody has to speak up and is loud enough and feel integrated in the group, what we normally have when we're sitting nicely together in a room. And this is part of the study to prove this concept, how we can deliver the session. One thing is the technology, the other thing is the content that we are doing, how we want really to have an interactive program, what's not so easy through Zoom, and to help them to feel as a group and to get this peer support, and maybe in the long run stay in contact with each other. And this is all about at the end. And and why we choose virtual, I think one thing, it's a new technology. And a lot of patients have very difficulties to come to personal sessions. It means that the parent has to take off work, they have to drive, they have to spend a lot of time sitting in a room and to meet. The virtual gives the teens also independency. They are independent from their parents. They can sit in their own room. It's very short, and they can, even when they live far away, they can participate. Even they can live in another province and they can participate and take this own ownership on to be part of the session and not driven by parents and depending from many other factors.
An incredible story, right? The fact that this was a patient who came to you because they had lived the gap. It's not like they lived the gap, and then they had developed the intervention. And it seems incredibly, evidence-based. It's very thoughtful because of the lived experience of the individual designing it. And it's very comprehensive, right? The fact that you have a multidisciplinary team. And I totally agree. Like, Zoom is hard. Zoom is hard to be interactive, but I also think context, that the individuals who are adolescents right now likely prefer, and likely, or logically to myself at least, they may actually be better at interacting and engaging than we are. I'm like, I don't know how to turn my volume on. Right? But they're absolutely so knowledgeable with technology, and it's just second nature, that it's truly kind of, you're bringing, like, the time and place and context and evidence-based medicine together. So really exciting work. Yeah. One question I have for you is, you did mention, this is really about the patients gaining that independence, right? Gaining the self-efficacy, what we call as confidence in research, to take really control of their own health. Are parents and guardians involved in any way? And do they play any role in support? Like, how do you interact with the parents, or do you tell them off the bat, like, your role is to support your child, but you're to let them do the work? Do you preface that?
Yeah, so it's a very good question. And so for this study, we have not so much involvement from caregivers because of the reasons that I already mentioned. And I think they always should support, and this is what we are doing in clinics, and parents should be supported that the kids are participating in these sessions. But we want really to focus on the teens. And what we did, that we want to include in each center during each session a young adult who suffered for JIA, but it's already transferred to adult and is in the new world of adult care, and to get to share some experience, what they have, and maybe to bring up some concerns and issues that they suffered through this process that we as a physician or health professional don't even know. And I think it's a good interaction to integrate this experience in our sessions.
Yeah, they almost act like as a champion, you know, and for someone who's perhaps younger, who's 8, 12, that age where they're just finding their voice, having, you know, somebody a little bit older come in and speak what they want to say and be able to articulate in a voice that I think is, you know, inspirational, but also just so helpful from the perspective of a patient, from the perspective of a healthcare provider, to know that from the perspective of a patient or a parent even, to have that be articulated. So just beautiful design. I think, you know, really, I want everyone listening right now to acknowledge and to realize that when you designed these interventions, it's not a haphazard, we threw everything in and we just hope it works. Like, it is thoughtful. It comes as an idea, yes, but then you build a multidisciplinary team to even just develop components of an intervention. Then you test, you refine, you test, you refine, you make it a little bigger, and then you refine, and you keep on going through this iterative process. I know that word's a little bit overused right now. It's an incredibly iterative process to develop an intervention and then put it out in the real world and see what happens. So with that, Dr. Heinrike Schmeling, I'm so excited to hear about the results of this pilot study. And, you know, we really do want to thank you for your time and sharing, you know, something that's like very near and dear to many of us. So thank you.
Thank you very much. It was a pleasure to talk about. And I would also like to thank all our patients, families, and advocating for our assurance to have a better life, and especially also the Arthritis Society to make it possible that we can do this trial. Without money, it's not possible. And other organizations like Cassie and France, Childhood Rheumatology Association, who advocate for children with arthritis, with rheumatology conditions.
Absolutely.
And co-investigators.
Absolutely. And, you know, echoing that, research doesn't really happen by yourself in an office. It is a huge endeavor to, like, as you said, all of your partners, all of the patients, Arthritis Society, which are the funders in this case, as well as all of the co-authors. So thank you to everyone involved in this project. Thank you for our audience. Thank you for tuning in. And we hope to see you on the next episode of Arthritis At Home. Bye for now.
Bye.